and we are going to do an NCLEX question together, okay? Now, before we do that, I want to talk to you just a minute about the NCLEX test. Now, what happens if you do not pass the first time? Do you know? Well, if you do not pass the first time, you're going to have to retake it, right? That's right. You're going to have to retake it if you want to be a nurse. But look right here. If you do not pass the first time, your odds of passing decrease. Now, the NCSBN, the governing body of the NCLEX, they tell us that if you do not pass the first time, that your odds decrease to around 45 to 50%. Now, I don't know about you, but I don't want to be put in that category. So let's pass it the very first time. What is the purpose of this test anyway? You've done everything your instructors have asked you to do. You have turned in that last paper that you've had to write. You've passed all your tests, and now you are ready to go and practice. Well, you still have the dreaded NCLEX. What is the purpose of it? Look right here, y'all. It is a safety test. That's what it is. It is designed to protect the public from unsafe nurses. Before they just hand you a license, they need to know that you can be safe. Can you keep yourself safe? Can you keep your coworkers safe? And can you keep your clients safe before they just hand you a license? So it is a safety test, and you have got to show them that you can be a safe nurse. And guess what? This test is unlike any of your other tests that you have taken in nursing school, but Hurst Review can help you. Now, what we are going to do, my friend Thomas is going to put a question up on the screen. It is a select all that apply. I want you to generate your answer and chat your answer, and then I will come back and we will go over the correct answer and the rationale. Now, when I say a select all that apply, remember, you could have up to 10 options, okay? And there are no limit on how many could be correct. It could be one, or it could be all of them. So approach each option as true or false. Look at option number 1 and ask yourself, is that true or is that false? Okay, I will be back in just a minute and we will go over the question together. All right, let's read this question together. To reduce the risk of developing a complication following balloon angioplasty, you are the nurse. You should implement which measure? Select all that apply. Okay, so let's talk about it. Now, the first thing we need to do is we need to figure out what they're asking us, right? Now, we've already said select all that apply. We need to approach each answer as a true false and pick all the true options. Now, you are a brand new nurse. Now, you need to know, first of all, what is a balloon angioplasty? That's what they're saying. The NCLEX people are saying, hey, you brand new nurse, do you know what a balloon angioplasty is? What is that, y'all? Do you know what it is? Well, that's where they take a balloon or a stent, right? And they place it in the patient's artery. Well, okay, that's what it is, but why? Why are we doing that? Why are they putting a stent or a balloon in an artery? What is the purpose of it? to open up the artery, right, to enhance perfusion. That's what the goal of this is. So now that we know that, let's see what we can do right here. Okay, now before we approach each one of these answers, we have got to think about the worst things that could happen with our client during this procedure. So think about some things, some complications that could happen with this client following a balloon angioplasty. I want you to think, I want you to assume the worst, okay? And I want you to think of things like hemorrhage. What about a stroke? Lethal arrhythmias? What about a clot? Absolutely. Okay, could they go into shock from hemorrhage? Absolutely. Those are the things that we want to think about. You have got to think about things that could kill your client, right? So now that we have assumed the worst, let's go back and let's look at our options. Are you going to do, number one, monitor the cardiac output or cardiac rhythm? Is that true or is that false? That one is true, absolutely. The primary health care provider should be notified of any rhythm change. What if they start reporting some chest discomfort or some pain? Hey y'all, that could be a sign of reocclusion. So absolutely, number one is true. Look at number two, true or false. Assess the puncture site every 8 hours. Well, that one is going to be halfway true, but every 8 hours, we're going to look at that puncture site, but that every 8 hours makes that statement false. These assessments are needed more frequently than every 8 hours, although your policies may differ, just depends on where you work. The assessment at that insertion site usually is going to be every 15 minutes for the first hour, and then every 30 minutes for an hour, and then they normally decrease that down to every 4 hours if there are no complications. Look at number three, measure urinary output hourly. True or false? That one is true. Why? Decreased urinary output could be due to poor renal perfusion, right? That's right. So these measurements are needed. Number four, prevent flexion of the affected leg. True or false? What do you think about that one? That one is true. Flexion should be avoided at that catheter access site to allow time for the clot to stabilize, and you want to reduce the risk of bleeding. And what about a hematoma formation? Look at number five, avoid lifting the buttocks up off the bed. True or false? What do you think about that one? That one is true as well, right? Listen, the client should avoid lifting their buttocks up off the bed because this increases pressure at the insertion site, which again, that could cause bleeding or the risk of a hematoma formation. So your true options for this question are number one, number three, number four, and number five. How did you do? Did you do good on that question? All right, now, I ask you, like when I ask you in this question that they're going to say, hey, you brand new nurse, what is a balloon angioplasty? Let's think about this. When you approach that NCLEX, you need to think like a brand new nurse. You need to think NCLEX-y. What does that mean when I say think NCLEX-y? Well, you have got to think like you have got to assume the worst. Like I said, you have got to assume the worst. No matter how minor the issue is, you have got to assume that it is really bad, okay? You have got to know that something bad is happening in every test question. Hey, it wouldn't be a test question if there wasn't something bad happening, right? You will never go wrong if you assume the worst. There's that safety, safety, safety again. Y'all, there will be a safety issue hidden in every question. You may not think it's a safety issue, but it is a safety issue in every test question. Now, the next slide will just show you some of the Hurst Free Events. There's a QR code there. Or you can go to hurstreview.com/free-events. Listen, we do mini reviews where you'll get to interact with an instructor, and then you will have a experience of what a real review will look like. NCLEX Challenge is where we review those high-level NCLEX style questions. NCLEX 101, hey, that is that core information that every student needs to know before they go sit for their NCLEX. Guess what? I have you a discount code, free 2025. That's going to get you $40 off of the InStream, which is a live streaming review. Hurst Now, $25 off, and Hurst Now Plus includes Elevate. Hurst Now is a video. Acid Base Essentials, that is a 4-part series that you can find at HurstReview.com. If you struggle with acid base, you will love this product. Make sure you're following all of our social media outlets, Hurst Review, on all of the social media outlets. My friend Ashley, she loves to give away free stuff, and she will keep you up to date on what's going on in the Hurst world and the NCLEX world. She and her friend Sarah, they've always got up-to-date information, and also they have a podcast. So check it out. HurstReview.com, there's our home office phone number. If you still have questions, call us. We will be glad to answer those. All right, that's all I have for now. Invite your friends to come back. We would love to have everyone needs to know about Hurst Review. So we would love to have everyone join in. All right, y'all stay safe, and we hope to see you again real soon. Bye for now.